Hello, I'm Tony. I work at Start Smiling. I qualified as a dentist in 2004, and as well as my dental qualification, I've also got a master's degree in dental implants and a diploma in medical and dental education. So I'm one of the mentors on SmileFast implants, and we have a number of dentists that are starting their journey in placing dental implants. They carry out a number of lectures and go on courses, and then they come to the practice here so that they can place their first implants under supervision, and I help them with the placement and planning all the cases and carrying out the surgery. So a dental implant is a way of replacing a missing tooth in the mouth through using these titanium implants, and they're inserted into the gaps you have, and that allows us to give you back teeth so that you can smile more confidently and function again, go back to eating the foods that you're not able to eat when you've got dentures or missing teeth. Well, here at Start Smiling, we've invested a lot so that we're able to provide implants to all sorts of patients. We've got a lot of education, and we've been placing implants, well, I've been placing implants since 2007, so we've got a lot of experience in it. We've got the scanners here so that we can scan your jaw. We've got the dental impression scanners as well, so we don't have to take those kind of sloppy impression material type impressions. We can do single implants, bridge cases, full arch cases. We also carry out Smile in a Day, where you get your full set of fixed teeth completed all in one day. So we offer a full range of options here. Well, there's a lot of planning involved in dental implants. The technology and the equipment required to carry them out and the implants themselves require a lot of investment. So when you look at the fact that you're planning to have something done that's going to last for, hopefully 10 to 15 years plus, there's not many things these days that you can get that are going to serve you every day for the rest of your sort of 10, 15 years that come in at a similar cost to that. So it's looking at kind of the long-term picture and how much you're going to get out of them. So here at Start Smiling, we've really encouraged the whole team to look at not just providing really good quality dentistry, but making sure that the patients are well cared for, and their whole experience from calling up, coming into the practice, throughout treatment and follow-up is all really looked after carefully. And everyone tries to get engage with the patient, learn about them as well as what their treatment needs are, but what they're looking for as well as that. So here at Start Smiling, we've always tried to provide the best dental treatment that we can, and we've been involved in mentoring other dentists, training other dentists. We get lots of referrals from sort of our colleagues and from our patients because they've experienced and seen some of the work that we can do. And we're pleased to say that it's built a good reputation, and because of that we're happy to accept sort of all these different patients with different needs. So today we've had patients that have travelled from the other side of London coming in to have dental implants placed. We've had some patients that have found our reviews on Google and looked into us and have come even from abroad sometimes to have treatments carried out. I think they just find the way that we explain everything is really clear. We're honest about what treatments are needed, and also we look at the whole mouth and the whole picture in the patient rather than just looking at the individual tooth or teeth that need to be worked on. So I think they feel more comfortable coming to us because of that. Well, it's nice to be involved in training dentists and placing implants, because I feel like over the years I gained a lot of experience. And you learn from the really good points, you learn from where cases haven't gone so well, you pick up all these little points from having different teachers and going on different courses. So when someone's starting off, they're totally unaware of all of that. So it's nice to be passing on that knowledge. You also learn a lot from the people that you're training, and it's nice to develop a network of friends and sort of colleagues to keep dentistry interesting and keep you on your game. So here at Start Smiling, we offer all sorts of different options for orthodontics and for teeth straightening. We can offer fixed braces, but they don't have to be like the metal train trap ones. We offer clear solutions, so they're white ceramic brackets. We also offer options for fixed that are on the inside of your teeth, so no one can see them at all. We offer clear aligner options. We've got digital scanners like this that we can scan your teeth without any impressions in just a matter of minutes, get it sent off to the lab, and within a couple of days we can give you various options for how you can straighten your teeth. And often those cases can be completed within a matter of months. Getting an issue that you've been bothered by for many years sorted in about 3 or 4 months can be life-changing for some people. So we have a lot of patients here at Start Smiling that come in and they've had some issues that have bothered them for many years, and it shows because they're not comfortable smiling when we're taking our photos, they're hiding their teeth when they're talking, and sometimes some simple solutions can totally transform their confidence. And as you see them over various appointments, they're talking more relaxed, more freely, they're happy to smile, and they tell us about sort of how much more confident they are, and how, like some people really say, it's like literally changed their life because they feel that they can go out now and be more confident and more relaxed. So we like to make sure at Start Smiling that the receptionists, the clinical team, and the dentists are going to make sure that if patients are anxious or they're unaware of something, we explain to them what's going to be happening. We can communicate with them via phone, email, send photos, send information, so they're fully aware of what's going to be happening on the day they arrive. And we make sure that everyone has plenty of adequate time so we can go through all their treatment needs. That helps to give the patient sort of some confidence on what they're having done, in terms of they're aware of what the options are, they've got to meet the people, and they know that their answers have been answered fully before they start having treatment. So at Start Smiling we use all the various digital options for planning our case and explaining it to the patient. We can take high quality photographs with our sort of SLR cameras, we can take intraoral scans with the scanners we've got, and then we can show all that information on big screen sort of monitors. And the patient can sit there and look at the screen, and we can work together to plan what they want to change in their smile. Look at how changing the position of certain teeth or their colour can improve their smile. And then we can send all of that information to the lab so that they're fully aware of exactly what the patient wants, and all those little tweaks and attention to detail can make a real difference in all the planning. So quite often at Start Smiling, before we go about doing a smile makeover, we will do either a scan or photos of the patient's mouth, and then we can use those to show them a sort of test drive of what their teeth will look like. We can even do that in the mouth by creating something that's like a demonstration of how the teeth will look like. That allows the patient to see how the teeth will look, test the smile, see how they feel in the mouth as well, and then once we're happy with all of that, we can go forward and recreate that in the final smile makeover. So often patients either come to Start Smiling or get referred to us for particular sorts of treatment, like cosmetic treatment or dental implants, or sometimes some extractions that other dentists have not been able to provide. And we often find, because of the level of aftercare we provide, like calling all of our patients up either that evening or the following day to check that they're comfortable, to check that they're pain-free and they're feeling okay, means that these patients often come back to see us again because they are so happy with the care they've provided and how gentle and caring everyone has been with them. At Start Smiling, we're continually investing in the equipment and materials to make sure that we're using things that really are the best available on the market, and that allows us to continually produce really good results, minimise patients' sort of pain, and make sure that the results they get are really long lasting. Just recently we had a young girl who was still at university came in, and she'd been really unhappy with her teeth for years and didn't feel comfortable smiling. She had a course of teeth straightening with cosmetic braces, and then we finished the case with some tooth whitening and some composite bonding. And the whole procedure was done within about sort of 4 months or so. And she's recently got back to us with a thank you card and said that she really appreciates what we did for her. And at her graduation, she was really happy with her photos because for the first time, even her parents noticed that she was really smiling and seemed sort of carefree with her photographs, and she really enjoyed the day. And previously she didn't feel that comfortable and that confident, so it really made a big change to her life.